Four, three, two, one. Good evening. This is Dr. John Bennett broadcasting from Miami. Tonight is another one in the series of Parkinsonism educational hangouts with Dr. Abdul Rana, neurologist from Toronto, Canada, and also renowned medical Parkinsonism educator. Tonight, Dr. Rana is going to be talking about autonomic dysfunction and excessive sweating. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
Okay, let's start off fast with this topic. How is excessive sweating related to Parkinsonism?
The exact cause why excessive sweating occurs in these patients is not clear because the autonomic nervous system controls the mechanism of normal sweating, and due to autonomic dysfunction, likely these patients have episodic sweating, and some of the patients could have very profuse sweating. They may just have drenches of sweat for a short time, then they might be okay. This can happen in the daytime, it could happen at night, and it may not be related to the medications of Parkinson's disease. It is a infrequent problem, but time to time you see these patients, and unfortunately, it could be quite socially bothersome to patients.
What are the consequences? I guess you kind of semi-answered that. It's embarrassing, but what are the other consequences?
Yeah, usually patients feel quite uncomfortable because this is somewhat unpredictable. It can happen anytime. They may be in a social gathering, or they may be out of home doing shopping, or it could be in summer. It could be even more bothersome because it's already hot and patients feel their clothes may become wet. So it does cause social issues. Patients have to they have to be careful that they might have to come home if they are out, because if the sweating is profuse, and sometimes it could cause smell from clothes, or trouble with the relationships with the significant ones. So it is a symptom which is socially somewhat problematic.
Okay, what can be done for this?
It is a difficult symptom to treat, and quite unpredictable. And first thing is to rule out other causes, such as if patients have a profuse sweating at night time, one should be careful to not assume that this is just due to Parkinson's, because if they have night sweats or fever or weight loss, there could be some systemic issues, or some of the malignancies or infections could present with the trenches of sweat. So ruling out this is important. A proper fluid intake is also important in these patients. Also dressing according to the weather conditions. Maybe cotton clothing could help. It could absorb the sweat rather than the other type of clothes. Also tracksuits are somewhat helpful. They would absorb the excessive sweating, and the patient should try to keep an extra face cloth in case their face becomes sweaty and they have to wipe it. We don't have much experience whether medications help this type of problem, but avoiding any foods which are rich in spices or very hot could be aggravating to this problem. And also changing socks a couple of times a day, or using the absorbents like the powder or antiperspirant sprays could be helpful, and dressing loosely, loose clothes could be helpful as well.
Very good. Anything to add on excessive sweating and Parkinson's before we close?
It's a symptom which is, as I said, it's uncommon, but it does happen, and it could be profuse. And you feel helpless because you can't tell patients that you take medications, it will go away, and it could indeed, in some patients, it could become worse. And I had a patient who had this problem, and otherwise his symptoms were in good control. And once he came with his wife, and the wife was quite upset about the symptom, and she said, "Doc, I can't just take his sweating because it makes a lot of stink in the clothes, and so he has to keep on wiping, keep on changing his clothes and socks." So it could be, it seems like it's a minor issue, but in some patients, it could become a significant issue.
Okay, so that wraps it up for excessive sweating related to Parkinsonism. Thank you very much, Dr. Rana, and we'll be continuing the series tomorrow night.
Thank you,
you.
Dr. Bennett.
Good evening.